Hi, this is Maureen Shaffer, and I wanted to say thank you to everyone who have been so supportive of the launch of the podcast recently, and in general around the marketing training videos for startups, medical device startups specifically. I want to take this opportunity to introduce myself to some of the folks if we have not yet met. I'm Maureen Shaffer. I am the CEO of Mingletoe and creator of the Message Engineer brand. A little bit about me. I grew up in the country outside of Buffalo, New York. So I know how to drive in the snow and I love climbing trees. I also grew up reading my mom's nursing textbooks for fun. She's kind of that strange child, but I always loved medicine. And I loved building things. When I wasn't outside running around or reading my mom's textbooks, I was at my dad's workbench building things. So, unsurprisingly, I chose to go into pursue biomedical engineering, graduated from Duke with a biomedical engineering degree, and was lucky enough to be recruited by Cordis. And such an amazing group of people, a real family, and a lot of responsibility and accountability. And folks there weren't afraid of debating and discussing and not agreeing, and we would still leave the meeting as collegial colleagues. I launched their first angioplasty balloon, their first jailable guide wire. Uh, Went to a small startup in Ann Arbor, and then out to U.S. Surgical, where with Anne-Marie Maman and a host of other people at U.S. Surgical, launched them into their cardiovascular franchise. So it was exciting days there. Uh, that was in Connecticut, so flew across the coast, started working at Hartport, which is a minimally invasive cardiac surgery company, and helped them launch into that arena. And that was exciting and a lot of learning and connection with a lot of, again, really tremendous people. HR had done a really knockout job of recruiting just such a high level of experienced folks. Uh, then I went on to another startup, and from there, took a couple years off to explore and try a lot of different things. And then popped out to AtriCure, so halfway back across the country in Cincinnati, Ohio. They were just shy of 10 million the year before I joined. I was there through very exciting times growing the company with Dave Drockman and Elsa Abruzzo and Sam Privatera, and Rich Walsh and other amazing people, and took them through their IPO to just shy of 50 million the year I left. Was the VP of marketing. I also picked up clinical education and reimbursement. So such an amazing experience, such great learning, great challenges. And from there, I was recruited out to another startup in New Jersey doing intrathecal pain management. And then was recruited to a software company out of Beaverton, Oregon, near Portland, where uh, or with whom we had developed together software to get marketing at AtriCure out of what I called the marketing post office. So content management, what we all now know as content management systems now, but to develop that so that the reps could quickly, choose a couple things. We'd wrap it with a marketing wrapper with legal regulatory disclaimers appropriate to that material, send it through any necessary kind of clinical or regulatory approvals, and document all of it. So they recruited me, Prolific, to punch them into the life sciences space. And I had the great opportunity to work with Jeff Gauss and Jim Van Kerkhoff and Jeff Pearson and Lisa Lundquist and Hemingway Hune and An Hune and other folks at doing that. And from there, I worked for them remotely, actually based out of my beach house in New Jersey. And started my own company, predominantly driven by two things. One, I had always wanted to start my own company and kind of live and die by my work and my decisions, and also so I could participate in the raising of my son, who is now 11. So it gave me the flexibility and freedom to do that, and the opportunity to work with again a lot of amazing startups. I love startups. I love medical device, med tech, health tech, digital health, and all the various ways it's now uh, and tangents it's now taking. And that's a little bit about me. So I live in a beach town in New Jersey, a couple blocks from the beach with my son and our Spanish water dog, Maple. And that's it. That's me. If you have any questions, you know where to find me. Drop in my DMs or in the comments. And look forward to spending more time getting to know folks and to bringing more uh, key education and information to the new up and coming product managers and product marketing managers in the medical device, med tech, health tech, digital health space. All right, that's it for now. Have a great day. Bye bye.